We're done.
Hi, my name is Zanthia Wiley, and I'm an infectious diseases doctor. I have the opportunity to take care of people who have infections like pneumonia, which is an infection of the lung, or a urinary tract infection, which is an infection of the bladder. And sometimes it's pretty scary, but sometimes my patients have infections of the brain as well. And it's my responsibility to give them the appropriate treatment, which includes antibiotics, to help treat these infections. Also, over the past 3 years, you all know everything, or you probably feel like you know everything about COVID, but it was one of my responsibilities to make sure that people were diagnosed with COVID quickly so that we can give them the treatment that they needed. And what I'm really passionate about is making sure that everyone, at least everyone who qualifies for them, gets their vaccines. But what a lot of people don't realize is about 25% and maybe even more of people develop more long-term symptoms from COVID, like they have difficulty concentrating, they have depression, some people have difficulty breathing. The question that I want to answer is, why is this happening to some people? Who is this happening to? And what can we do to make these people feel better? Because a lot of these people are children. Some of them are parents. Some of them may be teachers. So one of the things that I'm really passionate about is trying to figure out, why does this happen? And what can we do to make people feel better long term? My long-term career mission is mentorship. I grew up in a single parent household in a really small town in South Alabama, where there were not a lot of opportunities for people like me. And what I want to be able to do is to offer, many of the privileges that I've had to other people, especially people who may come from backgrounds where you don't think that you're able to do it. You may come from a single parent, household. You may be a Black person or a Hispanic person, and you've been told that there are many things that you can't do. What I really want to do moving forward is to be a mentor to as many young people that I possibly can, to remind you of how wonderful you are, and to guide you to become a scientist, and to guide trainees to become physicians and scientists, and to have your doctoral degree. And you may want to be a microbiologist. You may want to be a physical therapist. You may want to be a doctor. You may want to be a veterinarian. I want to be that person to help people, determine what it is that they want to do in life and to reach out there and get it. So one of my summer jobs when I was in high school was at my local hospital, which is a really tiny hospital of less than 20 beds. And there was a doctor there. His name was Dr. Barnes, and he was the first Black doctor that I'd ever seen. And he kind of took me under his wing and told me that I could do anything. And that was the moment that I always knew that I loved science, but this was the moment that I knew that I could become a doctor as well. So it was seeing someone who looked like me that really motivated me to become a doctor. When you really think about it, COVID and treating COVID and vaccines for COVID, all of this was about science. And many of you are from backgrounds where you may not see people who look like you, but I really want you to know that one of the people who was responsible for helping to develop one of the COVID vaccines was a Black woman. As you can see, I am a Black woman. So there are many of us who are out here who have done really important work, and I really hope that you're going to do that same work in your future.